The question was, there was a athlete who had a sports injury wrestling in high school and was told that he tore his cartilage. He apparently, if I understand correctly, has had some surgery, is now still having pain and disability in his knee, and wants to know if there are things can be done short of another operation. Just like we've been trying to emphasize tonight, we start with the easy things. So the first thing I have to start with is an accurate diagnosis. So if the patient chooses, the caller chooses, we can see the individual. Let's make sure we understand what's wrong, and then we can talk about the options to treat what's wrong. And the options for treating what's wrong almost always start with something non-surgical. And so what I try and emphasize to people is, I work for you. I'm going to tell you what the choices are, and you tell me what you're comfortable with, and then we're going to work from there. I am not going to try and force you to do something you don't want to do. I mean, that's never a good idea. So, but again, we must start with an accurate diagnosis. So if they're really having an issue and they want to see any of us at Carolina Regional, we can help start from the beginning and figure out what's wrong and what we can do about it.
And there are new things now that we don't know how long ago his surgery was, but I mean, I think
Sure.
It's just incredible to hear these new things that
Sure.
you're doing that, probably, 10 years ago, none of them were on the horizon even. So
Right.
that's great.
And he may have actually healed the pathology from his initial injury because of the surgery, and something else may be showing up.
Yeah.
And so Dr. Martin is right. Nothing is more important than a careful, detailed physical examination to really isolate the source of injury. Stepping back to stem cells, because that may be the choice that this fellow may need to address his injury. One of the most common things that we use is a substance that a lot of people have heard about but have a very poor understanding of. It's called platelet-rich plasma, or they hear the acronym PRP.